Hello beautiful people, good afternoon, maybe it is good morning your side, or good evening, or when you're even watching this video, I don't know. It is nice to have you back here. Welcome to my YouTube channel. If you are seeing my beautiful face for the first time, please don't forget to subscribe to my channel so you can be watching my videos. And if you're part of my returning subscribers, I say thank you for coming back to my channel. I love you so much, and please don't forget to subscribe if you haven't subscribed. So today I want to talk about blood glucose monitoring in Husky. So in case you enter your Husky room and you see the PM machine, gauze and lancets, you ought to know that okay, you want to check a blood glucose of a patient. So first thing first, yeah, it is for 8 minutes. So most times the examiner will tell you that okay, identity check has been done, so you are just expected to carry out your procedure like that. So as you enter the Husky room, firstly you wash your hands with soap and water under using the systems of hand hygiene. Then you clean with a paper towel, then discard into the black disposable bag, not the yellow one. Then when you are done cleaning your hand, then you put on your apron and gloves. So you need to also cross-check your equipment, maybe it is correct. So you are just going to verbalize, okay, I can see the test strip, it is well kept in a air, the air cannot enter into the container in a dark environment. Then the BM machine is well calibrated and has been in good use condition in less than 1 year. You need to ask the examiner that, so just verbalize it. Then check, maybe there's a lancet, there's a gauze for you to use as well. So when you have been able to identify your equipment and you verbalize it that it is clean and you know that this is what you expected to use, then you move close to this patient. So if in case they tell you okay, this ID check has been done, so you don't even need to start from the beginning again, but you can just feel like, okay, can I know your preferred name, so that whenever you are doing the procedure, you will know what you will call the patient, even though they told you that okay, the ID check has been done, so you can just move on. Then if you ask the patient what's the preferred name, you move on with your procedure. Thereby you tell the patient, okay, I'm here to do your blood glucose monitoring to check your blood sugar. Maybe it is within the range of 4 to 12, and if it is above, to know what to do, or if it is below, to know what to do as well. Then you you've already worn your apron and gloves, so there's no need to remove that because it's just for you to cross-check equipment. Then you move close to the patient. You ask the patient to scan all the necessary things you need to do. You put the strip at the tip of the BM machine. Then make sure you don't use the index finger, the thumb and the index finger whenever you want to prick the patient's finger for blood. Reason being that these hands are mostly used, so in case, just imagine a patient is licking sweet, it's not possible for them to use, sometimes they might not use the whole 5 fingers, but it's mostly common to use the index finger and the thumb. So don't use this when you want to prick the patient's finger. And even if you want to prick their finger, make sure it is by the side, like the side of their fingers, not mainly on the front part here, no, the sides of the finger. Then you, after fixing the strip into the BM machine, definitely you know that okay, the next one is to prick the patient hand. So you verbalize it that okay, the patient hand is visibly clean. So if in case you are seeing any dirty thing on the fingers, is the next thing for you is just to clean with the sterile water and not with soap and water. Just clean with a sterile water so that you can get the correct result. But in a Husky situation, I don't expect the patient hand to be dirty or to have any stain or anything. So you just verbalize that you can see the hand of the patient or the mannequin that is there is visibly clean. So you are happy to go ahead. Then you prick the patient's finger with the lancet. After pricking, make sure you are not using the thumb or index finger. Then at the side of the finger by the tip, you prick, you take blood. Then make sure the blood is covering the strip window so that you will get the correct one, so it won't show you there's an error. Because if you don't put it properly, definitely you have to repeat the hand or repeat the test, and it's just 8 minutes. So why bother wasting your time on just picking patient finger and you are not getting it right? Why you want to put the blood on the patient on the BM machine? So when you are done doing that, you've picked patient finger, you've been able to put the blood on the test strip window, then you wipe the patient's hand with the gauze you've taken. So clean the patient's hand to clean the blood. Then the BM is reading already. So when the BM is done, definitely will show you. So what you will get, sometimes in the OSCE they will tell you to do a pre-meal or post-meal. That pre-meal is in regards to, okay, this patient has not eaten. Then post-meal is mostly random. Why the pre-meal mostly calls it fasting blood sugar? Because the patient has not eaten anything. But either of the two, just ensure that anything you get from the patient BM, it must be within the range of 4 to 12. So anything below 4, that shows you need to give the patient, just verbalize it. But if it is there, just verbalize that you need to give the patient glucose or something to improve or to increase their blood sugar level, because currently it is low. So the patient can enter hypoglycemia. But if it is above 12, that shows the patient needs a diabetic nurse review, or maybe the patient can be placed on insulin because the blood sugar is above 12. Even above 12 is still needs review, because you just need to verbalize it. Not as if you are going to do it at that moment, but most times in those cases it's really within the range, but you just need to verbalize it during that procedure to let them know that, okay, you know what you are doing, and if in case that happens at clinical settings, you actually know what you are going to do about it, that you are going to escalate to the nurse in charge as well, because the patient BM is above the normal range. Even the BM machine will definitely make an alarm for you to put something that maybe you want to repeat the test, or the patient needs to take insulin, and the patient just sitting. It depends on the BM machine you are going to meet there. I think those are the main things. So after checking, just document, please document, and make sure that inside your booklet for you to document, you state it there that it is pre-meal or it is post-meal. Then you put the range, then put the unit, which is the memo. So let them know that you know what you are doing. Put the unit, put the results you get, and sign and date it. So when you are done documenting, you are going to remove your apron, remove your glove, then make the patient comfortable, tell the patient their score, make them know what they got, and reassure them, make them comfortable, give them call bell, and make sure you remove your apron and glove and you discard it into the yellow bag. Then you're done. That's it. BM is done. You've done checking, you've documented, and within 8 minutes you are done. So if in case you see BM procedure in your OSCE, I hope you'll be able to pass it very well with the little tips I've been able to share. Immediately you get there, do your things, cross-check your equipment, rapport with your patient, do the BM, and make the patient comfortable. So I wish you success. If you are writing very soon and you meet BM in your hospital, success, and bye-bye. Don't forget to subscribe. If you have not subscribed, subscribe and like and share. Thank you. Love you. Bye.